So good morning, everybody. Hope you're having a fabulous Friday so far, whether you're just getting started or coming to the end of your Friday. Welcome to Ask Doc Live. Just let everybody in here in just a minute. We will be getting started. Oh, I love all your smiling faces. That's fabulous. Awesome, awesome. And I see we have people from all around the world. I love it. Love it. And just so everybody knows, this is a program that you can share with other people and invite other people to. So if you are involved with longevity and on this crusade with Dr. Wallach, this is a resource made available to you. We always want to emphasize that if somebody shared this program with you, get back with the person that shared this program with you. So we do have a call team that's standing by, but that is only for people who have never been introduced to longevity by somebody specific or a friend or a loved one. So please only use our call-in number for no contact whatsoever with anybody within longevity or a friend that recommend this program to you. So this is the Ask Doc Live program. My name is Rebecca Kozak, and I will be your host for the next 2 hours. I am honored to be joined by my co-hosts, who are John T. McCollier, who is running all the technical stuff in the back end, and a beautiful Ruth Ellen Sanchez, who's here to help guide the chat and provide information in the chat. And also Nasima will be here with us here shortly. And if you have questions for Dr. Wallach, please raise your hand. Make sure you're ready to turn your camera on. He loves to see your smiling faces. That helps give him a kind of a visual, not kind of, it gives him a visual that he can see a lot of what is going on in addition to the information that you're sharing with him about health concerns for yourself or your loved one. So please raise your hand. If you're not familiar with how to raise your hand, in the Zoom menu, you've got 2 options. You can click on participants, and under the participants, there are 3 dots. Click on those 3 dots and you'll see the raise hand option. Also, depending on the version of Zoom that you have, in that menu bar are reactions. With those reactions, one of those options is raise hand. So I want everybody to know how to raise their hand and how to put comments in the chat. Now, whenever you are putting comments in the chat, you can hold the shift key down to hit enter, and it puts information on the next line without sending it to the chat. So we can keep all your information together. Please include age, weight, and height, in addition to your main concern and any other health concerns that are going on, whether it's a diagnosis, that all that information is helpful. All right. So I have to read this lovely disclaimer that the content of this program is to provide nutritional education information only. This program is not meant to take the place of your primary care physician. The FDA does require us to let you know that our products are not meant to treat, prevent, diagnose, or cure any diseases. Any testimonials that are shared on this program are real-life results using the products mentioned and recommended by Dr. Joel Wallach. As empowered individuals, you do have options. The purpose of this program is to share natural options that are available through supplementation. And we are honored to have one of the founding fathers of epigenetics here to guide us with the best options to obtain and maintain optimal health. Dr. Joel Wallach, welcome to Ask Doc Live.
Well, thank you so much for the kind introduction, Rebecca, and welcome to the whole team. Just always appreciate the mornings here with you guys and gals. And of course, we want to talk about longevity today. All vertebrates, have a optimal longevity, including human beings. There's no reason why human beings can't live well beyond 150, but you got to work at it. Your car can go over 300,000 miles, but if you put dirt from Texas in the car instead of oil, now there's bound to be some oil in it. There's dirt from Texas. You're not going to get 300,000 miles. You cut the fan belt because you don't like to hear that noise. Okay, you're not going to go 300,000 miles. You take out the air filter and let dirt get into your carburetor. You're not going to go 300,000 miles. If you use kerosene instead of gasoline, you're not going to go very far, okay, unless you have a kind of a diesel kerosene using engine. And so you really have to do all the right stuff for yourself if you want to maximize your lifespan. In modern times, the oldest super centenarian, some people who live beyond 110, was Jean Calment from France, and she died in 1997 and 122 years, 164 days. Okay, she was the oldest one in the last century. Then, right now, the oldest living person in the world is a Japanese woman by the name of Kane Tanaka. Okay, and she's 118, well documented. And then there is I shouldn't say there is a French nun. Okay, her birth name was Lucille Randau, or Randon, I guess it is Randon. And when she became a Catholic nun in France, they changed her name to Sister Andrea. Okay, when she was 116 years of age, she actually got COVID-19, and her caregivers all died from it, but she lived. Okay, she's currently 117 years old, and she lives in the Pyrenees Mountains in France, which is near Lourdes of France, where all these highly mineralized waters are. Okay, so you can begin to start seeing a pattern here. The people who, in the blue zones, there's 5 blue zones put together by Daniel Buettner, who is an exercise guru. And he believed that these people in the blue zones, and they're called blue zones because he took a blue marker and drew a circle around them on the map where he looked at places where people lived a long time. So he called them blue zones, nothing scientific, just a marker. But he said, all these people in these 5 blue zones live a long time because they're happy. He missed it by 1,000 miles. No, they're happy because they've lived a long time without any kind of really severe disabilities and pain and all that kind of stuff. And the reason is, of course, their diet. They live on islands or peninsulas that have volcanic ash and access to algae and seaweed and that kind of stuff, except for the 5th blue zone was in Loma Linda, California, the Seventh-day Adventists, but they're very religious people, and they're very, very tight on what they avoid and what they eat and how, and they supplement. They're big on supplements. And so they're part of the blue zones. And then let's see here. I think that covers that sort of stuff. And so you have to appreciate right now, with all this pandemic and stuff going on, there's other pieces you have to throw in, right? I've been for 25 years using our colloidal silver, put 2 droppers full under my tongue 30 minutes before each meal and 2 droppers full under my tongue 30 minutes before bedtime. Been doing that for 25 years. And it kills all bugs, viruses, bacteria, fungus, and yeast, and so forth. And doesn't have any negative effects on the person. I also have hand sanitizer, which you should use. Distance yourself and wear your mask, all that kind of stuff. But you also have to take your 90 essential nutrients, because all living tissue has a lifespan. And, it has to be replaced when it dies naturally. And so you need raw materials to give your stem cells what it needs to make a new liver cell, a new kidney cell, a new heart cell, a new lung cell, a new muscle cell, a new bone cell, a new tendon cell, a new cartilage cell, a new brain cell, a new eye cell. All these things die on a daily, minute by minute basis, and they need replacing. And if you don't take in the nutrients necessary for your stem cells to replace the ones that are dying naturally, you get what doctors call, you have an autoimmune disease. Your body's attacking itself. Shouldn't it be taking some vitamins, minerals? Nah, just eat well, you get everything you need. Well, any doctor who says that should be put in jail as a serial killer. Okay, particularly if they're telling you eat wheat. Serial killer, hello, okay. A double meaning there. So this is very, very important. When you look, for instance, who had the worst time during the Spanish flu, it was people from India. In 6 months' time, they had 20 million people die. They didn't have enough wood to cremate everybody, so they're just throwing the bodies in the rivers, and the bodies began to dam up the rivers. 20 million in 6 months, and these bodies were damming up the rivers and creating flooding and all kinds of negative stuff in India. They didn't really learn anything from then. Right now, the same thing is happening in India. They're dying at a rate of 3,449 per day. Right now in India, they have 230,168 dead. They have 21,664,900 infections. And the new infections are going up at 360,960 per day. So that every 3 days they're getting a new million infections. Now they were banging along at 16 million infections for about 6 months. You know, adding 50 here, wasn't a big deal. But boy, let me tell you, they really got hit because, you know, they said, well, we got 2% vaccinated. Everybody can run around and do what they want. And they weren't taking any vitamins and minerals. They weren't doing this, that, and the other. And so now they've got 360,960 to 400,000 new infections every day. And so every 3 days, you're getting 1.2 million new infections. And that's why they went from 16 million like 5-6 weeks ago to 21 million now. Okay, 21,664,000. So there's many, many reasons why you need to take your 90 essential nutrients, give your bone marrow, which is your immune system, what it needs to react to, let's say you get the vaccinations. That's everybody's choice. You're going to get the vaccination or not. We have to appreciate that vaccines do not kill viruses, bacteria, fungus, and yeast. They just alert your body to bad DNA and RNA that's in the viruses, bacteria, fungus, and yeast. When the bug comes along, everybody says, oh, there's some of those bad guys. And it will release white blood cells, and stem cells will release things like antibodies and red blood cells and platelets to go kill and eat the viruses and prevent you from bleeding to death during the battle against the viruses and bacteria. But if you're eating gluten, okay, you cannot absorb because the villi in your intestines are dead. So you're down to 2% absorption. And if you're not supplementing, 2% of nothing is not very much. And so this is why people who are getting vaccinated are dying like flies in India. And they're saying, oh, it's a new variant. No, it's just that the body cannot kill anything if it doesn't have the machinery to get antibodies and white blood cells to go kill it. So 90 essential nutrients. Don't forget, you want to take some extra stuff for your bone marrow, MSM, vitamin D3. I like the glucogel. Don't forget our Fucoid Z, which is more of the algae and seaweed and stuff like that. Again, these weird trace minerals that are necessary for your bone marrow to make what they're supposed to make. And also we have another one, in addition to Fucoid Z, we do have a liquid form of that called Z radical. So I don't take the liquid with me on the airplanes. It's too heavy. They won't let me take it on the airplanes. But I do when I'm at home, like on the weekends, I'll use the Z radical. And during the week and I'm in a hurry, I'll use the Fucoid Z. But I also take, and I've been doing this for like 20 years, the Ocean's Gold. So I'm getting the trace minerals from both oceans, okay? And so these are the sort of things. I'm 82 years old. And it's one of those things where people say, look, you got to be kidding. You're not 82. Yeah, I am. Okay. Now, here's a trick question. Okay. Are you ready for this, Rebecca? A trick question? I'm warning you, it's a trick question.
I'm ready.
When you're born, you're born. How old are you when you're born?
I was 10 months.
Okay, 9 to 10 months, you get an A+. Okay, so birth date plus 3 months, you're already a year old. So when your birth date, a year, okay, you go a year, now you're not 1 year old, you're already 2 years old when your first birth date comes along. Because the birth date is not how old you are. You have to start your aging from the moment the sperm fertilizes the egg and you've been conceived, okay? And so when you're born, you're something like 9 to 10 months old. And it's one of those things where most women do not take prenatal vitamins. Well, I'm not sexually active. Yeah, but you're in the birth, you're in the birth years. And you have to go back to the old days in the old Bible, in the old Bible, in the Old Testament. There's places in there when they say, men should wear men's clothes and women should wear women's clothes. Now, why would they have that in the Old Testament? Because they had transgenders back then. Okay, they had gender issues back then. What about Joan of Arc? One of the greatest warriors of all time. Was she transgender? Probably. Okay, because somebody who's a milkmaid and is raising kids isn't going to go out with a sword and kill a bunch of enemies. Okay, so these things are timeless. And so if you want to have a perfect pregnancy, even though you don't plan on a pregnancy, you better be taking vitamins and minerals and staying away from all the bad stuff to maximize absorption for a minimum of 6 months, 6 years, 30 years before you get pregnant. Don't be taking a prenatal vitamin. I missed 2 periods. I went and got, that little test strip from the pharmacy and I'm pregnant. I've already missed 2 periods. That embryo could be in deep trouble here. The hypothalamus in your brain, the part of the brain that tells you, okay, you're going to chase girls or you're going to chase boys. Or if it's confused because it was underdeveloped, because your mom didn't get everything she needed to develop your hypothalamus, okay, you can become a transgender. You could become a gay man. You could become a lesbian woman. You could become a bisexual. You could become an asexual. There's so many people who are asexual, both males and females. They're not interested in sex at all. Okay, because that part of their brain is not functioning because it was underdeveloped in that early pregnancy when they went from a flat disc into a tube. Okay, so this is very important stuff. And if you want to, give a young couple who are dating something nice, give them the 90 essential nutrients. Okay, get them on auto ship and make sure they're taking them. And so we can eliminate a lot of this confusion and so forth. And again, it's nothing new because it's in the old Bible. They had those problems and issues back then because the cause of those issues back then are the same cause of those issues now. Okay. And so it's one of those things where we have to be, a little ahead of the game here. There are things you can do. And that's, of course, we have, of course, the ultrasounds and things like that. You can do testings of embryos and things. And I really, really, really feel sorry for couples who have embryos with, really severe issues and they have to make a choice. Are we going to abort this embryo with all these severe issues? Are we going to raise this baby? And so on. And you can eliminate that crises by taking the 90 essential nutrients and staying away from the bad foods, maximize absorption. You'll add 25 to 50 healthful years to your life. Why not die at 122 years and 164 days like Jean Calment? Okay. Why not die like Methuselah? 969. Okay. And if you're talking about in the days of Moses, 300 years of age, that kind of stuff. But you're going to have to work at it. It's got to be a priority. You just can't be flippant about those things because your body, as it's forming inside the mom, you can prevent cleft palates, but if the baby's born with a cleft palate, you need to do surgery and fix it. Same thing with heart defects. Okay, if everything's perfect, that you'll be born with a perfectly normal heart. But if you're born with a heart defects, if it's severe enough, okay, they may put this newborn baby on a heart transplant list right away. Okay, and so you can avoid all this stuff and add 25 to 50 healthy years to your life just by, doing things correctly. And people say, well, my doctor says you're going to get all this stuff. This is an aging thing. No. You see people with gray hair. They're 12 years old, like Michael Jackson. Okay, vitiligo. They're black kids and they have snow white skin like Michael Jackson. Okay, or they have, maybe a middle-aged black person. They got little spotty vitiligo all over their body and on their face and everything is sort of disconcerting. What's happening to you? I don't know. I'm just kind of losing my pigment. Well, that's because it's not an aging thing. It's not an autoimmune thing. It's a nutritional deficiency thing. And that same nutritional deficiency that causes vitiligo, okay, which Michael Jackson had, and causes gray hair, which Michael Jackson had, also causes ruptured aneurysms in the brain and aorta and pulmonary artery, and you die suddenly from. And they're all caused by the same deficiency. And so, gray hair, varicose veins, and hemorrhoids, which is varicose veins in a funny place. Okay, your body's telling you That's your red warning lights. Hey, pay attention here. I'm telling you, you're going to die of a ruptured aneurysm if you don't deal with this. You go to the doctor, he says, well, you got to expect this. You're 60 years old. It's an aging thing. No, that doctor should have his license taken away from him. Okay, let's see here. I think we've covered the main things here. What's going on? Oh, one other thing. I did compare, because I did a Zoom last night in the Philippines, which I do like every other Thursday. And I was just checking, because we were talking about this aging thing, the average lifespan, the life expectancy of somebody from the Philippines is 71 years of age. They have 100 million population. In Vietnam, they have 97 million population, pretty close. Their average lifespan is 76. They live 5 years longer, okay, than the Filipinos. Well, why is that? Well, Vietnam, they have maintained their integrity as an Asian country, and they live on maize, corn, rice, sweet potatoes, beans, squash, and seaweed. Whereas the Filipinos, they've had so many armies in there, okay, for 100 years, okay? Well, guess what? They got Spanish, French, Americans, and all of their restaurants and places, schools and things where they eat, they tilt the dietary menu towards the Western cuisine, because that's where all the money's coming from tourists and the military. They want all these military people. And I spent a lot of time in the Philippines when I was in the Air Force. And so they tilt the diets in the restaurants and schools and hotels and things like that towards the Western cuisine, okay? And so that's why the people in the Philippines only live on an average of 71, and the people in Vietnam live to be an average of 76, okay?
Can I add something real quick, Dr. Wallach?
Yeah.
I was having a conversation this week with a young man, 31 years old, who told me he was in very good health. He didn't put the but in there. Was on a statin, was on a blood pressure pill, and had hemorrhoids. And I had to be very kind with my words.
Yes, he's got a deficiency.
Very kind with my words and ask, so what part of that, of what you just described to me is very good health?
Yeah, exactly.
So, I mean, these conditions, Dr. Wallach, that you had mentioned, 61, 50, 65 years old, are starting to be more profound in the younger ages.
Yes, exactly. And that's because they're eating more fast foods. They're not putting wood ashes in their gardens. They're not raising gardens. They're just eating fast foods. And again, I want to go back to the Filipinos versus the Vietnamese. Let's see here. In addition to the average lifespan, the Vietnamese have 35 dead from the pandemic. Just 35, not 3,500, not 35,000, just 35 dead. They have 3,030 infections. The Filipinos, they just a couple of days ago crossed over 1 million. They have 1,080,192 infections. And they're the, what should I say? It's really scary. They have 18,000 dead. Now, is 18,000 dead more than 35 dead? Is 1,080,000 more infections than 3,000? Okay, it's all diet. It's all diet. And I actually had some pharmacists and technicians double check me and check out, countries and states with the same populations, but Asian countries eating like Asians versus European countries, things like some of my favorites, of course, are Nigeria and Brazil. Both of them have about 208 million people. And Nigeria is 98% Black tribal Africans. Brazil is 47% white immigrants from Europe 300-400 years ago, 47% mulattoes, biracial, Black and white, and 9% Black. Okay, now the Nigerians, at 98% Black tribal people, they have 2,000 dead. Brazilians are the third leading number of dead in the world, 331,000 versus 2,000. And in Nigeria, they have 163,000 infections versus Brazil, it has 13 million infections. Same population. It's just totally a different diet because the Nigerians, they live on the west coast of Africa. They live on rice and sweet potatoes and beans and squash and seaweed, almost like an Asian. And the Brazilians live like Europeans for the last 400 years. And they're eating wheat, bread, and oats. And that's why there's this huge dramatic difference in infection rate and death rate in them. I'll give you one more here. And then I think it will, be right at the point where you need to start answering some questions. And the next one I want to talk about, let's do, a very famous state we're talking about the Sunshine State. Let's do Texas versus Vietnam. Again, Vietnam has 97 million people. Texas has 29 million. So Texas is about 1/3 the size of Vietnam. Again, Vietnam has 35 dead. Texas has 50,000 dead. Texas has 2.9 million infections, and Vietnam has 3,030 infections. So it's a difference. Well, again, Vietnam is 99.999% Asian, and they eat like Asians. And Texas, depending on what county you're looking at, there are 40, 50, 60% Latinos, Blacks, and indigenous peoples, Indian tribes, who live on nothing but wheat, bread, and oats. And so their intestines are dead. These peoples are not into supplementing, okay? It's not part of their culture. Whereas the Vietnamese, they're eating seaweed and kelp and stuff, which has all these weird trace minerals, which your bone marrow loves, okay, to make white blood cells and antibodies to defend you. And so when you start making these comparisons and you dig deeper, why is it that this country or this state has so many deaths and infections when another one down the line with the same numbers is totally different? It's diet, it's not race. And of course, everybody wants you to jump in and say, well, it's a racial thing. No, it's a dietary thing. I could take, say, 1,000 Asians and feed them a diet from the inner city, right? A black diet from the inner city of New York or Pennsylvania or something like that. And they'll have a high rate of infection and deaths. I can take black people, say take 1,000 of them and feed them like Asians and give them the virus, and they won't have any deaths or infections because it's a dietary thing. It is not a racial thing. So with that, everybody needs to get the Red Warning Light CD. Get a hold, we have 15 books. We got a couple of new books coming out here pretty quick. I'm excited about that. And we have over 100 CDs. We have over 50 DVDs, lots of stuff for education. They all represent lectures and research and so forth. And if people pay attention to that, and, if they're playing tennis 3 days a week, cut it down to 2 days a week and spend that one day, give up that 1/3 day of tennis and spend time reading and listening and learning how to add 25 to 50 healthy years to the life of your friends and families.
So, Dr. Wallach, I know that many of those books are also available as a Kindle edition. So for those who want to get it on their electronic device, that is available. And you can find Dr. Wallach's most popular books at AskDocLive.com. So we do have a store there that carries his books, and I'm very proud to be able to announce and make it easy for you to find there. But we also have a store there that carries all of the products that Dr. Wallach is going to be mentioning in today's program. So again, if somebody shared this program with you, please get back with them. Don't call somebody else that you don't know. Get back with the person you know, because they care about you and they have an interest in making sure that you get information that is going to be beneficial to you. So we have some amazing certified health coaches within our organization, and many of them are here on with us today, which I think is absolutely fantastic. Dr. Wallach, you're creating quite an army. Quite an army.
Well, that was the whole purpose of this. Yeah, that's the whole purpose of this, because, when you looked, even Moses had apostles that followed him and angels that followed him and carried on his words. Even Jesus had apostles and angels that carried on his words. So if these wonderful sons and daughters of God needed some help, I needed help too. So that's why we decided to create an army and follow their examples. And of course, now we do have an army. And of course, that's going to be the basis of these books coming out. Oh my gosh, it's really, really crazy when you see what's going on here, because there has not been any new edition of the Bible in 2,000 years. You think about it.
You're continuing on the history.
Yes, sir, that's right. We're going to continue on the history. Okay, it was started in the Bible. You know, we're talking about miracles. There are miracles all through the Old Testament. There's miracles for all the New Testament. Well, we have, let's see here, we documented 83 miracles in the Old Testament. There's 80 miracles in the New Testament. And right now, we have millions of miracles in over 50 countries over the past 73 years. Okay, and these are all wonderful tools that the good Lord built. We'll give the good Lord all the credit here. We have just figured out a way to expand his efforts and get all of his material out there, and we will give him all the credit.
Absolutely, absolutely. And, you know, taking his creation and putting them into formulas that synergistically work together, Dr. Wallach, is what you've done. You've taken your research, you found out what the body is supposed to have, what was missing when specific diseases were current, and it all came to over 600 different diseases are directly related to nutrient deficiencies.
That's correct. It's scary when you think about it. If you think about, again, in the Old Testament, where did people live the longest? Where were they the healthiest? Well, the land flowing with milk and honey. It wasn't all over the world. It was just one place where people lived the longest, and okay, because they had more stuff there. Okay, and they didn't know why, but they just knew that that was the place where everybody did well. And then when people were really good and they helped a lot of people, they were known as the salt of the earth. Did God say that salt was bad? No, salt is good. Only doctors say that salt is bad. Oh, you have edema, you can't have salt. Well, why don't you get rid of the cause of the edema? You need salt. Okay.
Right. Yeah, so let's talk about, Dr. Wallach, as we exercise, because I know weather is starting to get nicer and more welcoming. That sun is calling us out, getting more active. Now, when we're more active, of course, we're going to start perspiring, glistening, sweating, whatever you want to call it. But that's not just water coming out of our bodies, is it?
Well, has anybody ever licked their arm when they had sweat, the back of their hand? Does it taste what?
When it's dripping, it's a little salty.
Yeah, because your sweat contains everything that's floating around in your blood, okay? And so when you look at people who do exercise, they get paid for it. You know, let's look at professional athletes who get paid a lot of money for it. The average lifespan of professional athletes, in some cases, get paid millions of dollars a game. Okay, we're talking about really high-end people. And so they're doing everything right that they know. And when you take all the sports combined, their average lifespan is 62. The average lifespan of somebody who's lazy, does nothing, eats everything bad is 75 in the United States. Especially if they don't exercise, they'll live to be 75. If they exercise, it's 62, except for basketball players, it's 51. Okay, well, that's why we came up with Rebound, our sports drink with 100 nutrients in it, 75 minerals and 25 vitamins and amino acids in it. Okay, all the other sports drinks are really energy drinks, you know, like Red Bull and Gatorade and stuff like that. They have 2 or 3 nutrients in there, a lot of caffeine and sugar. And they just came out a week or so ago with another big study on soft drinks and carbonated drinks. They said, oh, the people who drink even diet colas and stuff like that, they die 10 to 15 years before people who don't drink those kind of drinks. Okay, so if you want to shorten your life by 10 to 15 years, drink more Diet Colas. This is a university research, okay? I'm just reporting what data is, and it's not me picking on somebody. I'm just reporting this research that came out. And so you really, 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 really have to pay attention to what you're eating, what you're drinking, what you're not eating, what you're not drinking, okay? Because we do require stuff. And of course, we were getting some of it here and there based on where people lived, again, because nutritional minerals don't occur in a uniform blank around the crust of the earth. They occur in veins like gold and silver. And there's places on earth where people live a long time. Okay, the people who live the longest are up in the Hunza Valley by the Giltar Glacier between Pakistan and China. Their average lifespan is about 165. The oldest documented one was 265. Okay, Dr. Lee Chin Yun. And there was a book written about him called Lost Horizon by James Hilton. They made him in 1933. They made a movie out of it in 1937, same movie, Lost Horizon. And he was, James Hilton was a very, very vicious reporter, an investigative reporter for the New York Times and the London Times. And they sent him to China to check out this Dr. Lee and Chun, because he's selling herbs and everything and telling people he's 265 years old and so forth. And so and he followed him for a year and he said, no, this guy's real. Okay. And that's when he came up with the book and the movie. And so everybody needs to watch those things and read the book and watch the movie. And of course, these new books will just blow your mind when they come out here in a few weeks.
Well, I'm excited to be able to read them. I love all of the books. I've got a few of yours right there, and I have a few over here. And I love to be able to have them as resources, Dr. Wallach.
Mm-hmm. Well, that's what they're there for. You can look things up. And
yeah,
of course,
it's not a book that you just read through once and then put it away on the shelf. It's something that you can refer back to time and time again.
Okay. And there's lots of references in each one of them. Mm-hmm.
Absolutely. Absolutely. Lots of references.
Yeah, so people don't have to take my word for it, okay, because we reference everything, so they can go back to the original research. And of course, one of my favorite studies was done by Johns Hopkins. They looked at the 8 most common causes of death in American hospitals. This came out about a year ago. Okay, it'll be 2 years in August, this coming August. And they came out and said there's 8 major causes of death in American hospitals. Number 1 is heart disease. Well, was it the heart attack that killed the people going in there, or was it the treatment for the heart attack, or was it 50-50 treatment and the heart attack? Number 2 is cancer. Again, was it the cancer that killed them in the hospital, or was it the treatment? Chemotherapy and radiation, all that kind of stuff, right? But the one that really got me, really brought a tear to my eye, was number 3. The number 3 cause of death in American hospital. Now, this is Johns Hopkins, very famous medical school, Baltimore, Maryland, very famous university, Baltimore, Maryland, Johns Hopkins, not me. I'm just reporting what they said. They said the number 3 cause of death in American hospitals each year, not hospitals in the world, but just American hospitals, is medical errors. Your doctor makes a mistake in dosage. He gives the wrong medicine. He gives the medicine from one patient to a different patient, pick the wrong patient or something. Medical errors is the 3rd leading cause of death in American hospitals. And so if they prevent doctors from going into hospitals and treating people, more people will survive. It's crazy. Over to you, Rebecca.
Yeah, so those medical errors don't always end in death, Dr. Wallach, and people just have to suffer with the results of them. And that's what kills me. I see people every day. I have people in my family that have been through that. Mm-hmm. And, once the damage is done, even supplementation in some cases
is not helpful. That's correct.
It's not helpful. So, all right. Well, Dr. Wallach, let's go ahead and move on. Let's go to some happier subjects and start helping some people that are here on the line with us. So again, everybody, this program is sponsored by AskDocLive.com. We do have a website there. And on that website, we are going to have this recording of this program and all of our past programs since the day that we started are all there. So as you are going through and asking questions, I know Dr. Wallach speaks very quickly, but you can go back to the recording and re-listen to it as many times as you need to make sure that you get everything that he has mentioned. So I want everybody to take advantage of that and share those videos with people. So there are some descriptions there that'll help you be able to do a search and find out what um, conditions are mentioned on the program. And then you can share that specific program with somebody that you care about. Let's go to the first hand up, Dr. Wallach, and that is Barney. Barney, go ahead and unmute yourself. I see you have your camera on. Thank you so much. You are on live with Dr. Wallach.
Hi, Doc.
Hi.
I talked to you last year around October for some tinnitus and numbness in the hands. But since then, I ended up with sepsis, and that ate away my heart valve, and I had to have it replaced. And so I've been taking warfarin, and your tangy tangerine and your D3 both have vitamin K in them. And
okay, do you know what warfarin is?
Yeah, it's a blood thinner.
No, it's a rat poison. It makes rats bleed to death. Warfarin is a rat killer. Okay, now, how old are you and how much do you weigh, Barney?
I'm 61 years old, weigh 175 pounds, and 6 foot tall.
Okay, do you have any other issues, high blood pressure, diabetes, anything like that?
No.
Okay, well, just for our listeners, when you have tinnitus, when you have ringing in the ears, and your hands are tingling and numb and so forth, that means you have osteoporosis of the skull. It's not an age thing. It's not an autoimmune thing. It's just osteoporosis, which includes the skull. We have a book out called It's All in Your Head, 25 different diseases you get from osteoporosis of the skull. Tinnitus is ringing in the ears. Oftentimes you get dizziness with it. Did you have any dizziness or vertigo or anything like that?
Occasionally when I stand up too quick.
And the answer is yes, because you have osteoporosis of the skull. And then when you have numbness and tingling in your hands, your doctors might say, oh, you have carpal tunnel syndrome. But really, it was your skull squeezing the spinal cord coming out of the back of your skull. Even doctors don't remember their anatomy because your spinal cord is formed in your brain, not in your neck and your back. Your spinal cord is formed in the brain, comes out of the big hole in the back of your skull called foramen magnum, which is Latin for big hole. And as that spinal cord gets squeezed when you have osteoporosis of the skull, you start getting numbness and tingling in your hands. It's kind of like peripheral neuropathies in your feet and toes, okay? Where you get low back stuff, you get sciatica. When you get numbness and tingling in your toes, it's not a toes and an ankle problem, it's your lower back problem. When you get numbness and tingling in your hands, it's not a hand problem, it's a neck problem and a skull problem, okay? And then sepsis, of course, is kind of an infection in your body. And again, I want to see people using our colloidal silver, okay? 2 droppers full under your tongue. And if you take Ultimate Daily Classic tablets, take 3 of those, your body weight, 175 pounds. I want you to take 3 of those twice a day. They will support and promote healthy blood pressure, but they will also support healthy blood flow through blocked arteries, whether it's in your eyes, your brain, your heart, your kidneys, and so forth, legs, wherever. And say Ultimate Daily Classic tablets. That's in addition to the Healthy Brain and Heart Pack. Guy 175 pounds like you need 2 Healthy Brain and Heart Packs per month. We'll dose everything twice a day. And again, I'm saying this for not only you, but for your listening audience here. You need 2 bottles a month of our MSM, so you can take 3 with each meal. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone self. Don't forget vitamin D3. Take 3 of those twice a day. That's 2 bottles a month. That'll help absorb minerals, particularly calcium, and put it in your bones and things like it's supposed to. And don't forget for the sepsis thing, even if you're taking antibiotics, I would still take 2 droppers full of our colloidal silver under the tongue, 30 minutes for each meal and 30 minutes before bedtime. And I go through about 2 of these bottles per month. Been doing it for 25 years. And again, I'm 82 years old and don't have any of these problems. Okay, but I can tell, do you have varicose veins in your legs or spider veins in your feet or legs, anything like that?
No, I don't.
You have some gray hair in your mustache and your hair.
Yes.
Okay, well, all those things are not caused by aging. They're caused by nutritional deficiencies. And it's the same nutritional deficiency that caused problems in the valves in your heart. Okay. And doctors want to blame it on a lot of things, but it's just nutritional deficiencies. Okay. And so you got to get rid of the bad stuff. You cannot have one cheat day a month, not one cheat meal a month. You got to be free of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, brown rice, no sugar. And I get people who, I mean, were completely bald. I mean, you have quite a bit of hair left, but I've got people who are like a bowling ball. They've been completely bald for 40 years. And just after 3 months on our program, okay, getting rid of all the bad stuff to maximize absorption, taking all the good stuff, their hair grew back like it was when they were 12 years old, you know, the original color without any gray or white hair. And so it's an amazing talent, if you will, that your body has to be able to rebuild itself and maintain itself. But you have to avoid the bad stuff so you can maximize efficiency of absorption. And you have to consciously supplement with the 90 essential nutrients, because you can't depend on what may or may not be in the food. Otherwise, you're really in trouble before you even start. Okay, so keep in touch. Call us every couple of weeks. Don't wait 2 years. Call us every couple of weeks. And whether anything's happening or not, give us a call. Yeah, nothing's happening yet. Okay, we'll talk to you some more and so on, see what's going on. But anytime you go into the doctor's office and they do a blood test or they do some kind of exam, call us, let us know what the doctor said and what the blood test showed. Because we have a lot of people who are middle-aged like yourself, who are 60 years old, 61 years old, okay, whatever it is. And you want to be sure that they're getting this information, because they're hoping and praying you're going to do well so they can do what you do, so they can actually get the same benefit also.
Okay, but what about the warfarin and vitamin K?
Okay, so what you want to do is, if you're taking all the 90 essential nutrients, you're going to avoid blood clots, which is the purpose of them giving you rat poison. That's why warfarin kills rats, because they bleed to death. They don't have any clotting in their blood. And so I wouldn't be real happy about my doctor giving me rat poison. Okay, so what you want to do is, I'd go to a different cardiologist and say, hey, is this warfarin dose correct, or is there another, you know, anti-clotting pharmaceutical I should be taking? I really don't like the idea of taking rat poison. Can you reduce this dose here? And let another doctor at the other end of town, who doesn't know the one who's giving you rat poison, you know, reduce it. Yeah, we can reduce it 10%. Okay, and then you go back to, you know, to him again a month later, whenever he says, you know, your blood clotting time is really too long here, so we're going to reduce it again. It might take him 3 months to slowly reduce and eliminate that warfarin. You don't do it cold turkey. You do it by the test, okay?
Yeah.
Okay, keep in touch with us and let us know how it goes, but I'd go to a different doctor and ask, you know, to test for your blood clotting time, say, you know, I really don't like the idea of taking rat poison, so what can we do here to make sure I'm not going to get blood clots? I am taking supplements. And if that doctor says, oh, you shouldn't be taking supplements, then leave that doctor, find a different doctor.
Okay, but the vitamin K does interfere with the warfarin. And
well, that's a good thing. Otherwise, you'll bleed to death.
Yeah. Okay.
Remember, warfarin causes rats to die because they bleed to death, because it prevents blood clotting.
I get it.
So, Dr. Wallach, there's natural things that we can do to thin the blood, clean the blood, keep the blood clean.
That's what the 90 essential nutrients are for. You stay away from the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, brown rice, and oats. And then there's several of these nutrients in the 90 essential nutrients that prevent abnormal blood clotting. People say, which one is it? Which one is it? And I used to tell them what it was. And then they would go to, you know, like Walgreens and buy that one nutrient, and 3 months later they died. And I said, what happened to your husband? I haven't heard from him. Well, he died 3 months after you told him what to do. What? Did he take all 90 essential nutrients? No, he just took that one. Well, that's why he died. He died from the stupid gene.
So everything works synergistically together within the body. Our body doesn't need just one specific nutrient.
Yeah, any doctor who just gives you warfarin and you have all these issues, somebody needs to go to jail here.
Yeah. Yeah. So, Dr. Wallach, we've got a question in the chat here that says, what can a person using blood thinners take in place of EFAs?
There is no such thing to replace EFAs. It's kind of like saying, what can I take to replace oxygen? what can I take to replace water? Okay, you can't do it. Okay, the essential nutrients are essential nutrients. Okay, it's not the essential nutrients' fault if you have a problem. Is it because you're not absorbing it? It's because you're taking a pharmaceutical that masks it so it can't do its job. Okay, you know, just like these professional athletes that die at 62 or 51. These people are eating well. I mean, some of their meals cost them a couple $100 a meal. I mean, they are eating the best foods and taking the best pharmaceuticals and all that kind of stuff. And they die early, 30 years early, okay, or 50 years early. You know, 51, athletes should be super centenarians. Every professional athlete and university athlete, every athlete who's in the Olympics should live to be 110 or more. But they eat improperly, they don't supplement properly, and so the exercise becomes a negative. It's like, you know, you drive your car 30 miles an hour and you got oil in there and you got lubricants and all this kind of stuff and coolant. But if you don't have any of those things in there, driving 30 miles an hour, your car will still burn up and die.
Just like our bodies will.
That's exactly right.
Yeah. And with EFAs, essential fatty acids, they're essential because the body can't make them. We have to take them in.
Right. And so not only do they reduce the risk of blood clots, but they're also required for the biochemical structure and function of the cell walls of every cell in your body. Your brain, your eyes, your heart, your lungs, your thyroid gland, your liver, your kidneys, your muscles, your bones, your cartilage, blood vessels. Every tissue cell in the body requires EFAs for the membranes in every cell to function properly.
Yeah, it's amazing what just, you know, adding the 90 essential nutrients. People don't believe that it's going to help, but it's so simple. So simple.
Yeah, try going without oxygen for a couple hours.
No thanks. Like living, love living. So Dr. Wallach, Jana has a testimonial. She says that I've taken the longevity products for years and have finally gotten serious about getting off the bad stuff, gluten, etc. And I have lost 15 pounds.
Wow.
So that's awesome, Jana. Congratulations on that. And next, let's go to a question that has been submitted. There we go. So I have a client who is 46 years old. She is gluten-free and eats healthy. She's 5'7".
That's what they all say.
I know. 5'7", 126 pounds. She thinks that she is in perimenopause with spotty periods. Some are missed, some are very heavy, and she has mental fog. She is looking for the best female hormonal product that she can use to help her as she is on a budget.
Okay. Well, in addition to getting rid of all the bad foods, which she says she's doing, no fried foods, no processed meats, no oils, no glutens, no wheat, butter, ribose, no sugar. She also needs to eat 3 eggs twice a day with soft yolks. Hard-boiled eggs won't count. Fried eggs cause cancer. Soft-boiled eggs with soft yolks, soft poached eggs with soft yolks, soft, runny scrambled eggs in butter, because 95% of the weight of estrogen is cholesterol. She cannot be taking statin drugs. She cannot be avoiding eggs, right? And she's foggy. 75% of the brain weight is cholesterol. Duh. Okay. So then she should also be taking, in addition to her 90 essential nutrients, she might have some osteoporosis of the skull. So she needs to take the MSM, take 3 of those twice a day to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes bone itself, artery walls, vein walls. I also want her to take vitamin D3, 3 of those twice a day. Okay, that's 2 bottles a month, so they can absorb minerals, particularly calcium, and put them in all the right places. And then to answer a very specific question she had, we have what we call Xerafem. Okay, it's the raw materials for ovaries to make estrogen and progesterone. So I want her to get 2 bottles of that a month, so she can take 3 of those twice a day or 2, 3 times a day for a total of 6 a day of the Xerafem. And I also want her to take the Woman's FX. She could take 3 of those twice a day, the Woman's FX. Okay, and that's going to give her things that are going to support all the stuff that she's trying to do here with her cycles and this, that, and the other. Now, 46 years of age is a little bit early to be going through menopause. Most women who are healthy and doing everything correctly, they will still have regular cycles and healthy cycles, and, proper levels of their cycle and so forth at age in their 50s and early 60s. Okay, and so when they're having problems at age 46, this means she has an absorption problem, she has a deficiency problem, or both, and all this kind of stuff. And so we have these programs we've been doing for over 50 years. And so we help a lot of women going through what she's going through. Doctors will give you a lot of bad advice.
Well, and so it kills me, Dr. Wallach. You know, we think that pain is all part of getting old. We think that cramps are part of the menstrual cycle.
No.
And it's so untrue. It's so untrue.
That's correct.
I know for myself, I mean, I don't even get moodiness. Just ask me. But but I love not having what so many people are complaining about with the cramping and with the mood swings and just aching all over. It does not have to be.
Do many of these people ever ask you, Rebecca, what are you doing? You're always so happy and so forth. What are you doing different? What do I need to do here?
I do have people that ask. And they said, oh, I take supplements. I take couple Centrum every single day.
Yeah, 27 nutrients.
Yeah.
Not even a third.
And then they're from rock, Dr. Wallach. So you shared with us last week the difference between minerals from rock and minerals that have been processed through a plant.
That is correct. One is almost 100% absorbable, and the other one is only a couple percent absorbable.
Yeah. So, oh goodness. So we are coming to the top of the hour, but let's see if we can fit one more question in, Dr. Wallach.
Okay.
Let's go to John. John, go ahead and unmute yourself. You are on live with Dr. Wallach.
Yeah,
hello, John.
Dr. Wallach.
Yes, sir. How can we help you?
I guess I'm reporting after a couple of weeks. Really not feeling much change yet, but
Okay, well, stop. You got to remind me how old you are.
Yeah, I'm 63.
How much you weigh?
5'5", 216.
Okay, and what were your complaints a couple of weeks ago?
Well, I have the AFib, cardiomyopathy, ED. So,
okay, I remember you now. Okay, now you have to appreciate, you have osteoporosis of the skull.
Yep.
Okay, and so that's not going to, what should I say, heal itself completely in 2 weeks.
No, I understand that.
Okay. And so you really need to crank down, get rid of all the bad stuff. You need to really crank down, take everything we talked about. Okay. 2 healthy brain and heart packs, MSM, vitamin D3, Ultimate Daily Classic. You need to be taking the glucogel and the Fucoid Z, all that kind of stuff. Okay.
Glucogel? Okay.
Glucogel, absolutely.
I hadn't heard that one before.
Yep. All that stuff. And again, this is for our listeners so that they're all getting the same information. And I take people who, I had a big wager with an eye doctor, eye surgeon, and I said I could reverse macular degeneration blindness. And he gave me 27 of his patients that he had diagnosed, so he couldn't argue with the diagnosis. They were legally blind, 6, 8, 10, 12 years. And to make a long story short, put them on the same program I put you on. And in 90 days, remember, they're legally blind, 6, 8, 10, 12 years. And he's an eye doctor. So he's the one that made the diagnosis, not me. Couldn't argue with the diagnosis because it was his diagnosis. In 90 days, all of them could read 20/20 without glasses. Okay, yes. Because I was able to rebuild the skull, take the pressure off the optic nerve and the optic artery and the optic vein, okay, which really messes around with the eye. So you get what's called ONA, optic nerve atrophy. And of course, doctors don't know about this. And so they say, well, you have macular degeneration. But then they say, no. You don't have cataracts, because I can see a cataract, but even without ophthalmoscope. I could just look at your eye with naked eye and see a cataract if you got one. Same way with blood pressure and pressure in the eye, okay, glaucoma. That's all caused by, you have that too, yeah, it's osteoporosis of the skull, squeezing that optic nerve, but also squeezing the artery going into the eye and squeezing the vein coming back out of the eye. So all these things going on are all secondary to osteoporosis of the skull. And of course, you have other things going on all over the place. Cardiomyopathy heart disease is a specific nutrient deficiency. AFib is not a heart issue. AFib can be squeezing of the first 4 thoracic spinal nerves, okay, kind of like a peripheral neuropathy that can be caused by osteoporosis of the skull, squeezing the 10th cranial nerve, the vagus nerve. Do you ever get hiccups?
No.
Okay, good. Do you ever have dry, unproductive cough like COPD?
Not really much, maybe the odd time, but.
Oh, every once in a while, okay, yeah, okay. Yeah, so these are all caused by osteoporosis of the skull. So yeah, keep calling, call us every couple of weeks, okay, and pay attention to details. Okay, call us every couple of weeks. It's toll free, so it's not going to run up your phone bill. And just, give us a kind of live talk like we're doing now every couple of weeks. And there's going to come a point when, oh my gosh, this point is getting better. That point's getting better. But it might take 4, 5, 6 weeks, okay, depending on the severity. Yeah, okay.
The main reason for my call today was it was about my sister. She got a call yesterday that she's got cancer. So
okay, well, I'll tell you what, this is going to be a little lengthy here. So let's take our break here, and
okay.
And Rebecca will make sure that you're on, whether you're going to hang on or you're going to go away and come back in 5 minutes or whatever. Let us take our break here, and then that way we don't have to hurry through your sister's diagnoses. Okay.
Okay. Do you want me to?
You talk to Rebecca.
Raise your hand back up, John. We'll get you.
Do you want me to send the text of the information a bit? To you directly?
You can also call back on you and you can just go over it with Dr.
Okay, I'll put my hand back up. Thank you.
Yeah. So thank you, everybody. Go ahead and get up, stretch, run to the little kids' room, whatever you need to do. We are going to take about a 5-minute break and we will be right back with more of AskDocLive.com. A reminder, we do have the recordings of our program. We have a store with all of the products that are mentioned today, and Dr. Wallach's books. They can all be found at AskDocLive.com. Now, again, if somebody referred you to this program, you don't want to use the store that's there. You want to get back with them because they have their own store or their own source of getting the products, and you want to make sure that you are supporting the person that shared this information with you. So we will be right back. Don't go away. All right, welcome back, everybody. As Dr. Wallach is coming back on with us, I just want to again thank you for joining us with the Ask Doc Live program. Again, this program is brought to you as a community service and resource. There are so many things out there that we can do on our own as we are empowered individuals. And the things that we are sharing here today are nutritional approaches to being able to obtain and maintain better health. There are so many things that we have grown accustomed to just accepting that is part of getting old. And I'm here to say that old age does not have to hurt. We do not have to have disease. Those things are all preventable, and in many cases, they can even be reversed. So I am honored and privileged to be able to bring to you Dr. Wallach. Dr. Wallach, if you could go ahead and unmute yourself. Let's go ahead and continue on with the program.
Now, can you hear me now?
We can hear you now fabulously. Thank you so much. So before we get back to John, Dr. Wallach, Nasima had a couple of questions last week that we didn't have a chance to get to. We ran out of time.
Okay.
So Nasima, if you could go ahead and unmute yourself and ask Dr. Wallach the questions that you have.
Hello, Nasima.
I know she's here. Oh, maybe she's not back from break yet. But so let's.
I'm back now.
There she
I'm
is.
here. I'm here. Hi, Dr. Wallach. Thank you for everything.
Okay, wait a minute. You got a huge echo. I can't understand you. So you got to do something. I don't know what it is, but you got a huge echo.
Oh.
Seema, I think it's just the room you're in. I don't think there's a technical issue.
Oh, okay. Then maybe I'll ask the question another time.
Try opening your doors, Naseema, because that'll let, if you have glass doors behind you, open those.
Is that better?
Say again?
Is that better?
A little bit. You have to speak slowly.
Okay. Okay. So doctor, the first client's question that I have, she's a 12-year-old girl, was born with Prader-Willi syndrome.
Which is?
I'm not exactly sure what that is, but she can't stop eating. She also has pulmonary hypertension. I'll look on the internet what Prader-Willi syndrome means. In the meantime, she also has pulmonary hypertension, scoliosis, and cor pulmonae.
Okay, how much does she weigh? How much does she weigh?
She weighs 60 kilograms.
So 130 pounds.
And she also has type 2 diabetes. And she was diagnosed with the scoliosis at age 3.
Okay. All right. Well, she's got an absorption problem. None of these are genetic. None of them are autoimmune. They're all just simple nutritional deficiency diseases. And so I don't know if she was fed a formula, if she was fed wombat milk, or if she was breastfed, or we don't know any of that. But she has to get rid of all the gluten out of her life. Everybody in that family, grandma, mom, dad, brother and sister, renters, schoolmates, dog, cat, bird, fish, everybody, including her, has got to be drop dead gluten-free. And then at 130 pounds, I wanted her to have 1 healthy brain and heart pap per month. She needs to get another bottle of our selenium so she could take 3 twice a day or 2 with each meal, okay, for a total of 6 a day of the our selenium, not from Walgreens, our selenium. Then she's also going to need our MSM, get 1 bottle a month of the MSM so she can take 6 of those a day, 2 with each meal or 3 twice a day, whichever is easier for her. Then because she has this high blood pressure stuff, she needs the Ultimate Daily Classic tablets. She needs 3 of those twice a day. That's 2 bottles a month, support healthy blood pressure and healthy blood flow through blocked arteries. And she has type 2 diabetes. She needs 2 bottles a month of the sweeties. So you can take 3 of those twice a day or 2, 3 times a day for a total of 6 a day. And she cannot cold turkey off if she's on medication. She can't cold turkey off the medication, but as her blood sugar drops, she can slowly reduce the medication. Okay, so I think that covers all of her issues. Yep. And I think we've covered all of her issues. And so, you know.
Thank you, Doc. And I looked up on the internet, Prader-Willi syndrome. It says it's a genetic disorder caused by a loss of function of specific genes on chromosome 15.
Have you ever heard of the science of crapola?
Yeah.
Crapola? Okay, yeah. All of these things are caused by nutritional deficiencies of gluten, okay? And she may have a issue with 1 chromosome, but that's not causing all these things, okay? These are all caused by nutritional deficiencies. And that's the difference between genetics and epigenetics. Give her all the nutrients, maximize her absorption. And most of this, if not all of it, will go away within weeks or months.
Thank you, Doc. The second client's question, is there such a thing as hypertension only in the head? Because this girl, 20-year-old, her doctor's saying to go to the eye doctor if the pressure builds up behind the optic nerve.
Okay, well, what would cause that pressure to go up behind the optic nerve? Osteoporosis of the skull. How old is this person?
20-year-old, but I don't have the weight or anything.
Yeah, okay. And so, yeah, it could be glaucoma. So you see, when you have osteoporosis of the skull, you can be born with it. If the mother's not getting right nutrition, can't give all the nutrients to the embryo. So the baby's born with osteoporosis of the skull. It's not an aging thing, okay? It's nutritional deficiencies. And the optic nerve comes out of the brain through the skull to the back of the eye, but also the artery that feeds the eye goes from the brain along with that optic nerve into the back of the eye. And the vein bringing the fluid back from the eye. You can't just keep pumping stuff into the eye. You gotta, you know, and so the vein coming back from the eye back into the skull goes along with that optic artery. So as the optic nerve is being squeezed, so is the optic artery and the optic vein being squeezed. Causes all these problems, okay? And so this will be one where there's magic. We need to know, you know, how much she weighs and what other things are going on. Because usually when you have that kind of stuff going on, they have ringing in the ears, they have skin problems, they have eczema, they got IBS, irritable bowel syndrome, they've had appendicitis, all this kind of stuff, which tells you there's more going on than just in her eye.
Thank you, doctor. Thank you for everything.
Okay, you are a super angel. Thank you so much.
Thank you.
Thank you, Nasima. All right, Dr. Wallach, let's go ahead and go back to John and let's get some
his sister.
For his sister.
Okay, John, how old is your sister? How much does she weigh and what other issues does she have?
Okay, so she's been, okay, so she's going to be 70 in November. So I guess if you want to count her 9 months, she's
no, just let's keep going. I got other people I need to talk to.
Okay, so she weigh, I don't have her weight, but I would say it's probably around 170. I think she's about 5'2", 5'3".
Okay, any other issues?
Well, she's been having asthma, lung issues for a number of years. She had a scan a year ago, didn't show anything, but then she had a scan this year, and they say she has small cell lung cancer that has spread to her liver, 2 lesions on her lungs and 1 on her liver. It is a very aggressive cancer at stage 4. The next spot it will seek out to spread is brain and bone. I have a CT scan.
Okay, that's enough. I
Okay.
get it. Okay. So when you're in stage 4 cancer, this is really a very, very life-threatening thing, and you know we can't make any guarantees here. But some people say, you know, the doctors say, well, she's got maybe stage 4, she might have a couple of months to live. Well, we take people like that, including Coretta Scott King, okay, the wife of Dr. Martin Luther King. She had stage 4 cancer, and they only gave her a couple of months to live, and she lived 4 more years after we began to give her a program. So you can actually maximize life and increase the quality of life, even though you're stage 4 cancer, if you do these things. She needs to do the same as you. Get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown rice, no sugar, no carbonated drinks. At 170 pounds, I want her to have 2 of the healthy brain and heart packs per month, a full dose of everything twice a day. I want her to take the MSM. I want her to get 2 bottles of those so she can take 3 with each meal. Going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone cell. And I also want her to have vitamin D3, 3 of those with each meal. That's 9 a day. That's 3 bottles a month of the vitamin D3 to absorb minerals and put them in the right places. And to support her immune system, I want her to have the Fucoid Z capsules. I want her to take 3 with each meal. That'll be 9 a day. That's 3 bottles a month. It's all these weird trace minerals from the algae and seaweed from the oceans. And the bone marrow loves it. And the bone marrow is going to help support her immune system and also send out the white blood cells and antibodies to help attack the cancer cells. But I do want to hear from you every couple of weeks about yourself. I want to hear every couple of weeks about your sister, anytime she goes in for a CAT scan or ultrasound or blood test and all that kind of stuff, same way with you. So we keep up with what's going on and we can tweak things and make things better. And so I do expect to hear from you both for yourself and your sister. Okay. You bet.
She's about to start chemo next week.
Okay, well, we've told you what to do.
Yeah, I will pass on the news, and I thank you very much for your time.
Okay, God bless. Okay, Rebecca, what's going on?
All right, thank you, John. Dr. Wallach, let's go to the next hand that is up. Uchi, go ahead and unmute yourself. You are online with Dr. Wallach.
Okay.
Hi, Uchi.
Hi, Dr. Wallings. Okay, I have several
Okay, stop.
questions.
Okay, wait a minute. Where are you from originally?
I'm from Nigeria.
Okay. Okay, go ahead.
Okay, I have several questions that my friends asked. So I said, okay, I will ask in the program. I joined the program that from the UK for women. They were talking about hot flash. And so many people said that some of the doctors said that hot flash causes dementia in some women. Is it true? And if it's true, what are the supplements that will stop the hot flash?
Okay, okay, stop. You're saying that some of these women are complaining about dementia and the doctors are blaming that on the hot flashes?
Yeah.
Okay, all right. We have to appreciate that 75% of the brain weight is cholesterol. You cannot be on statin drugs to lower cholesterol, okay? Must get rid of all the bad foods that cause inflammation. No fried foods, no processed meats, no oils, no glutens, no wheat bran rhinos, no sugar. And then, is she your size or smaller?
Smaller.
Okay, how much do you weigh?
It's about between 50 and 60 age, 50 to 60 age. And then the weight is about 56 to 60 kg.
Okay, 60 kg, so maybe 140, 150 pounds. Okay. All right. Okay, so we want her to get rid of all the bad stuff. And then we want her to take 2 of the Healthy Brain and Heart Packs per month, full dose, everything twice a day, 2 Healthy Brain and Heart Packs a month. I want her to get the MSM, 2 bottles of that a month, so you can take 3 with each meal. That's going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone self. I want her also to eat 3 eggs twice a day with soft yolks. Hard-boiled eggs won't count. Fried eggs cause cancer. Soft yolks, poached, soft yolks, soft-boiled, soft yolks scrambled in butter. Okay, 3 twice a day. She can have 3 times a day if she wants, but no less than 3 twice a day, because 75% of the brain weight is cholesterol. Then I also want her to have de-stress capsules. She needs to take 3 of those twice a day. That's 2 bottles a month. I also want her to have our Woman's FX, take 3 of those twice a day. That's 2 bottles a month. And then one of our secret sauces for this is the Xerafem, Xera-FEM. Okay, Xerafem is the raw materials for the ovaries to make more estrogen. Okay, so I want her to have 3 of those twice a day, and you got to watch it. She can't just take the Xerafem, she needs the eggs, and she needs to get rid of the bad food. She needs to take all these other supplements we just talked about, because if she just takes the Xerafem, she's not going to get maximum benefit, okay? And so you got to watch that. You got to be careful that she knows she's got to do the whole program if she wants to get maximum benefit, okay?
Yeah, okay. So actually what they say, the doctor said that she has to increase her estrogen.
Well, that's what we're doing. She's getting the eggs, okay? 95% of the weight of estrogen is cholesterol. Then she's getting the supplement, Xerafem. She's getting Woman's FX, and she's getting all the 90 essential nutrients. And this will help her make more estrogen. Don't let her have the doctor give her prescription pharmaceutical estrogen. Okay, she can make her own.
Okay, then another question is that the person, when she goes to another person, when she wants to go and eat herself, before she runs to the toilet, then the wee-wee has already dropped. That is, the urine has already dropped. Now, what is the cause that is dropping the urine?
Okay, I'm not getting a whole lot here because you got a big echo, but I heard that something happens with her urine when she wants to go to the bathroom.
Yeah, it drops.
So it sounds like she's starting to urinate, Dr. Wallach, before she gets to the bathroom.
Oh, okay. So she's got some
incontinence.
Incontinence. She can't control it. Okay. Yeah. And this is going to be a back problem. Okay. And that's why I wanted to have the MSM and the vitamin D3, because back problems squeeze the nerves to control the bladder. Doctors either forget that, or they're kids in college and they want to treat her so that they can pay the tuition.
So this is the second person. Mm-hmm. So the 90 nutrients with the brain and heart pack, the MSM, glucogel. Correct, Dr. Wallach?
That's correct. And of course, the glucogel, and don't forget the Fucoid Z. We want to get the bones and all the nerves and everything in good shape, because 99% of the time in these cases, it's the nerves controlling the bladder. They're being squeezed by her back because she's got osteoporosis, degenerative disc disease, and all that kind of stuff going on in her back.
Okay, then the final question is, most of my church members, we had this problem in the church recently that some people will go to bed, they are active like today, then they will go to bed, then they will not wake up from sleep. So what is, then some people are—
Okay, okay, stop. Somebody has to tell me what she just said because all I get is echo.
Okay, what I said is that—
No.
I
cannot understand you. Rebecca, you have to tell me what she said.
Unfortunately, I didn't catch everything.
Okay, let me.
Yep, I'm sorry. I think what she's saying, if I may, Rebecca, is some people in her church are having issues where when they go to sleep at bedtime, they just don't wake up.
And
they're dead.
Yes.
Okay, well, this is not uncommon.
And we advise that we should start taking aspirin, maybe because it's a rupture of the brain that causes bleeding in the brain. That we should take
there's 100 different things. Okay, and so these people, somebody needs to do an autopsy on some of these people that go to sleep and don't wake up dead. Okay, and so somebody needs to do an autopsy on them and find out what killed them, because you're going to guess here, and there's 100 different things, okay, that can cause the problem. And
okay, so is aspirin good for me and every other person of 50 to 60 years to start taking as a precaution?
Okay, I'm going to leave now because I can't understand a word she's saying.
Yeah, she said, is it a good idea to take aspirin, or should she stop giving aspirin?
No. Aspirin, of course, can reduce the risk of blood clots, but it also can cause bleeding. Okay, and so it's one of those things where you don't know what you're dealing with. Are they bleeding to death in the brain? Do you want to keep taking aspirin and bleed to death in the brain? Okay, we don't know. And so rather than just guessing, you need to get rid of all the bad foods, take the 90 essential nutrients, and somebody needs to find out what these people are dying from. I remember we're talking about 1 a year, we're talking about 10 a month. I mean, you know, we need more information here to find out if this is just a random thing or if it's some big thing going on because they have lead in the water at the church. I mean, who knows? I mean, you know, we need to find out, and just guessing won't help anybody.
Okay.
All right. Thank you, Jay.
Thank you.
You're welcome. So, Dr. Wallach, the next question is, Beatrice has a lady that she is working with. She's 77 years old, 5'7", 125 pounds. She woke up one morning and could not breathe properly. She went to the doctor and she was told she is highly anemic. She's still having breathing problems. She can only walk a few steps, and then she has to stop. And
well, you went away. I don't hear anything now.
Yeah, Rebecca, your screen is frozen. So in the meantime, while Rebecca fixes her technical issue there, we see a hand raised by Elaine. Elaine, I'd like to ask you to unmute yourself and be available by video. Yes, thank you. Elaine, go ahead.
Okay, I'm here.
Mm-hmm.
All right, I have a question. I recently went to the doctor and I was diagnosed with hypercalcemia, and I've had I am taking Tangy Tangerine and done very well to help me with my asthma. I'm wondering, my question is, I had a thyroid strand. They said my parathyroid has shrunk.
Okay, Elaine, just one moment, please. Are you available by video as well? And doctor would like to address your question.
I'm not at video at the moment.
Okay.
I know he wants my weight, age. Want me to start there, Doc?
Yeah.
Okay, 150, 5'6", 60 years old. And so basically my question is on my thyroid issue.
Okay. Thyroid, parathyroid. When you have elevated blood calcium, it's almost always a parathyroid problem. That means you're not absorbing calcium, you're not getting enough calcium for one reason or another, and your parathyroid glands are overreacting. They're pulling calcium out of your bones. And people say, well, how can I be getting too much calcium? I don't even supplement with calcium. Well, that's because your parathyroids are pulling calcium out of your bones. And Elaine, you're a perfect candidate to get a hair analysis. Get the book and the CD called Rare Earths and Cures. Chapter 9 will tell you how to collect the hair, how to package it, where to ship it. Don't forget to put the check in. They won't run the test without the check. And we want to find out what's going on with the minerals in your body. There's two charts. So one that goes into the essential minerals, okay? And the other one goes into toxic minerals like lead and mercury and that kind of stuff, okay? And so we need a hair analysis to find out, to answer the question, but the odds are that it's it has to do with the parathyroid gland pulling calcium out of your bones.
Okay, and they say that the parathyroid has shrunk and that it's not working effectively, obviously. Is that something that can be restored?
Of course, but you have to be able to
Wonderful.
absorb it. So she's got to get rid of all the bad stuff. Then she's got to take all the good stuff. Then we have to find out what's going on here in detail. Okay, when you start having organ and gland shutdowns, you got some serious problems here. And so it's definitely worth it to get that hair analysis done so we can find out exactly what's happening. And doctors will say, oh, your parathyroids aren't working. Well, how do they know? Okay. I didn't hear any tests that they did for the parathyroid glands. They're just guessing. Okay, so we need to find out these things.
I did one scan, but you know what? I'm going to do the hair analysis and then call you back.
Yeah. Okay, good. Thank you so much.
Thank you.
Okay, let's keep going here. I'm getting calls stacking up.
Okay, Doc, I have the information that Rebecca started asking about from Beatrice Oliver. She is 77 years old, 5 feet 7 inches tall, 125 pounds. She woke one morning and could not breathe properly. Went to the doctor and was told she has highly anemia. She is having breathing problems. She can only walk a few steps and she has to stop and rest up. What can she take to get her strength back?
Okay, well, first of all, the odds are she has osteoporosis of the skull. She has maybe asthma and anemia, okay? She may have a squeezing, I don't know if she's got anything going on with her heart, okay? Irregular heartbeat, AFib, fast heart rate, slow heart rate. So at 125 pounds, I wanted to get rid of all the bad foods, no fried foods, no processed meats, no oil. Somebody's stirring coffee or something.
Oh, sorry, Doc, it was me, not.
Okay, so gotta get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, and oats, no sugar. And then at 125 pounds, I wanted to get one healthy brain and heart pack per month, another bottle of our selenium, so she can take 3 of those twice a day. Okay, and a half a dose of everything else twice a day. I want her to get 1 bottle of the MSM so she can take 3 twice a day. That'll support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone itself. And being anemic, she can be not absorbing stuff because her intestines are dead because she's eating gluten. Okay, and her bone marrow can be dead because she couldn't absorb nutrition to maintain her bone marrow to make red blood cells. Okay, and she could be not absorbing omega-3 essential fatty acids, which result in a breathing issue. But if you're severely anemic, you can also have a breathing issue because you can't carry enough oxygen if you don't have enough red blood cells. So all those kind of things are going on there. And so, let's see here. I'd also have her take the Fucoid Z. She can take 3 of those twice a day. It's 2 bottles a month. And let's see here. I also want her to take she needs eggs. She needs 3 eggs twice a day with soft yolks. That's going to help her maintain her brain and also what's going on in her bone marrow. Excuse me. And let's start there. That's a lot. But she's got some problems which can be life-threatening here.
All right, thank you so much, Dr. Wallach. I just love technology. It's so fabulous when it works.
Okay, what's next?
Okay, perhaps there's still some issues going on. So Kathy Jacobs has a question here. She says, I took your advice about a year ago and got off all the bad foods, especially sugar. I recently ordered Tangy Tangerine, which has tapioca, maltodextrin, OsteoFX, and herbal rainforest. Both contain fructose. I'm concerned about this much sweetener. What are your thoughts?
Okay, well, when you have 210 nutrients in a product, it's going to either be bitter or acidic or this, that, and the other. So there has to be a little bit of sweetener in there. We're not talking about tablespoons of sugar here. We're talking about a few drops in the capsules. And so that's not going to cause any problems. But it's good she's reading labels.
Thank you, Doc. So we will go to the next person who has their hands up, and that is Yunette. Yunette, I'm going to ask you to unmute yourself and be available by video. Hello, Yunette? Okay, I guess I don't see her being
Hello.
Oh, there you are. Okay, go
Hello?
ahead, Yunette, with your question, please.
Hi, good afternoon, Dr. Wallach.
Hello.
Can you?
I'm getting a little bit of an echo here, so you're going to have to speak clearly.
Hello.
Okay, that's better.
Hello. You can
Okay,
hear me.
I can hear you now. Yes. Tell me what's going on. Okay, I think Nasima.
She seems to mute herself.
Sorry, Doc. Yunette, I muted you because we're having issues hearing you. So, Doc, a general question, how about, actually, there's one from Steve that just popped up. How to treat macular degeneration?
Okay, well, macular degeneration, of course, can be a diagnosis, but there's all kinds of things that go on with the eye, including osteoporosis of the skull, squeezing the nerves, squeezing the blood vessels, and all kinds of stuff. And oftentimes doctors don't know what to say, why you're losing your vision, why the pressure is going up in your eye. And they just say, well, you got macular degeneration. They just say that stuff, okay? And so these people with macular degeneration are glaucoma, or both, are cataracts. Now, cataracts there's a surgery for. Okay, I only do one eye at a time. I wouldn't do both eyes at the same time. But at any rate, when you have macular degeneration, if that's correct, none of the bad foods, okay, that can be caused by inflammation, eating fried foods, processed meats, oils, glutens, wheat, bread, oats, and sugar. And then they need to take one healthy brain and heart pack per 100 pounds of body weight. They need to take the MSM, 3 of those twice a day per 100 pounds of body weight in case they have osteoporosis of the skull, squeezing the optic nerve and the optic artery and the optic vein. And then they need 3 eggs twice a day so they can maintain the white matter of the brain, which is 75% by weight cholesterol. They need 3 eggs twice a day with soft yolks. Fried eggs won't count, and hard-boiled eggs won't count. And then I would also take the Occutive, take one of those twice a day, that's 2 bottles a month. Take the Vision FX, take 3 of those twice a day, that's 2 bottles a month. And then call us every couple of weeks, call us every time they go to the eye doctor and get some kind of update on what's going on with the eye. And we'll see if things are progressing, if they're staying the same or getting worse. But maximizing absorption is essential. If you're going to spend the money for all these supplements, you want to make sure you're absorbing them all. So got to get rid of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, bread, oats, and no sugar. Okay, let's try a couple more here. And if we keep fuddling around like this, I'm just going to ask that we call it a day.
Sorry, Doc, of the technical issues here, but we'll keep going. I just want to remind everyone, get your good food, bad food list by going to askdoclive.com. You can contact us through there, email us through there. And when you're ordering, if you're an existing customer or distributor, please circle back with the person who sent you. Replays of this show are available on askdoclive.com. Do invite others. We want to grow this. We're expanding our army and looking for more and more people. So Doc, a general question now. How about MS? What's the general protocol for MS?
Okay, MS, multiple sclerosis, Parkinson's disease, ALS, Lou Gehrig's disease, they're all the same disease. Okay, it's just they affect different parts of the brain more severely, so you get different symptoms, so they gave them different names, okay? So when people have all those different problems, they need to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, rye, no sugar. They need to take 3 eggs twice a day per 100 pounds of body weight. Hard-boiled eggs won't count. Fried eggs cause cancer. Soft yolks, soft boiled, soft poached, soft scrambled butter. Then they need to have, they can send 2 healthy brain and heart packs per month. They also need to get the de-stress capsules, 3 of those twice a day. The ultimate niacin plus 1 of those twice a day. The, let's see here. I would also throw in the Fucoid Z, 3 of those twice a day. That's 2 bottles a month. And then I would also throw in the, let's see, I said Fucoid Z. I would throw in the, let's just go with that. Let's just go with that, okay, and see what benefit we get here.
Wonderful. Thank you, Doc. We do have a person with a raised hand. Sharon, please unmute yourself and be available by video.
Yes, thank you. Hello, Doc. Yeah.
Hello.
Hi, listen. Oh, it's such a pleasure to get to meet you. You're just awesome.
Oh, you're very kind. How can we help you today?
Okay, I'm 68. I'm a retired X-ray technologist. I'm 5'3", 145 pounds. I do have spider veins and white hair. I've been on your program for about a year now with the Minerals in a Healthy Body Start Pack. My question is, I've developed tinnitus.
Mm-hmm.
And
okay, well, tinnitus is caused by what?
Osteoporosis of the skull.
Yeah, you get an A+, exactly. And of course, it's squeezing the auditory branch of the 8th cranial nerve. And so you have an absorption problem. So a lot of people say, well, I'm not taking any gluten. Well, do you cook food for your husband or your kids, your grandkids? Well, yeah, I cook their meals.
Yeah.
Are they getting gluten? Yeah. Well, you're getting cross-contaminated in the laundry and the food preparation surfaces and so forth. And that's why you're not getting the maximum benefit. Okay. So everybody's either got to move out of the house or you move out of the house or they got to change their diet. I'm serious. Otherwise, you're not going to get the benefit here. Okay.
Right.
This is life and death stuff. Usually within 2 to 3 months, the varicose veins and hemorrhoids should go away. The hair color should start coming back in your hair. But if you're not having those things happening, you're still getting gluten from somewhere. And usually it's because you're being kind and you're cooking everybody else's meals. So, and you know, you're throwing flour, you know, on something or whatever. You got to stop it. Okay. And so, you know, hose them down before they come in the house. You don't let them in the house without hosing them down in the front yard. And so, again, you got to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, rye, no sugar, 145 pounds. I would take 2 healthy brain and heart packs per month, full dose everything twice a day. And let's see here. I said the MSM, take 3 of those twice a day because you got vein problems here and you got osteoporosis of the skull. And so there's a lot of things happening inside you. You don't know what's going on. You may only have 10% liver function. Okay. And so because the same things that are causing the tinnitus in the ears, which is you're very aware of that, you can also be getting problems in your liver and your kidneys and your heart, your thyroid glands and so forth. So it wouldn't hurt to throw in some Fucoid Z capsules. You can take 3 of those twice a day. And let's go in that direction. Okay.
Okay. Thank you so much.
Okay, dear. God bless you.
All right, Dr. Wallach, thank you so much. Dr. Wallach, Kathy has a question in regards to sugars. So she took your advice and got off all the bad sugars, especially sugar. And she recently ordered the Tangy Tangerine.
Oh, we went through that. We went through that with her already.
Oh, I apologize. That's when I was off. All right, let's go to the next one. So Natalie is 62 years old. She's 5'9" and 185 pounds. She recently gave a double red blood cell donation. And she does have a thyroid issue recently, as in last week. Now she's in the hospital. Her blood pressure is 212 over 180. Her pulse is anywhere from 150 to 230. Doctors are thinking that it's because the medications for her thyroid were not being distributed throughout her body. Can you share with us a little bit about what might be going on and what we can do to help her?
Okay, well, she's not absorbing properly, okay? And she's got all kinds of things going on here, including osteoporosis of the skull and so on. So we need to get her off, again, all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, bread, no sugar. Everybody in the household, dog, cat, bird, fish, spouse, renter, kids, grandkids. So there's no cross-contamination in the laundry and the food preparation surfaces. You know the drill, okay? And then at 185 pounds, she needs 2 healthy brain and heart packs a month, a full dose, everything twice a day. She needs 2 bottles a month of the MSM. She can take 3 with each meal. That's going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, makes your bone itself. I want her to take 3 of our Ocean's Gold capsules twice a day. That's 2 bottles a month for her thyroid. I want her to take 3 of our Fucoid Z capsules twice a day. That's 2 bottles a month. That's for her thyroid. Because the trace minerals that come in those 2 products come from 2 different oceans. So we're dealing with 2 different oceans here. Because she has high blood pressure, she needs to be taken the Ultimate Daily Classic tablets that will support healthy blood pressure and healthy blood flow through blocked arteries. Okay. And let's see here, that also help her kidney function. And I think we've covered the territory here. Okay. Oh, she should also give up cruciferous vegetables, cabbage, broccoli, cauliflower, Brussels sprouts, and kale, because they interfere with thyroid function also.
All right, thank you, Dr. Wallach. Next question is coming from Robin, and she writes in, my mother's nursing home is asking me to reduce the amount of supplements I'm providing. Currently, mom is taking about 25 pills per day, and she's not been eating. She was doing super good, Dr. Wallach. What she is on right now is the On the Go Pack, MSM, Ultimate Daily Classic, Biocalcium, Synaptive, Niacin, Killer Biotic, De-Stress, D3, Selenium. And all of them are products. And now she's had a history of dementia. She was doing fabulously and regaining her memory.
Stop. Okay, stop. Do we know if she's getting gluten, you know, pancakes and waffles and spaghetti and stuff like that and oatmeal at this
Her daughter
home?
Her daughter has told him she has to be on a gluten-free diet. Whether they're going by that or not, we do not know.
Okay, the odds are they're not. And so I would get a hair analysis on this gal, this woman. Okay, we need a hair analysis on her, and we'll find out whether she's absorbing. We'll find out if she's got toxic metals. We'll find out a lot of stuff by a hair analysis, because the doctors there and the nurses and caregivers are guessing. Oh, we think this. Well, what tests do they do to come up with that idea? Okay, maybe they're just giving her more pancakes for breakfast, or they switched from potatoes at dinner time to spaghetti. You know, who knows? And so we need to find out what's going on here, because if she's doing great and then suddenly now she's not doing great, and it may be she's going to have to go to a different nursing home if they're telling you to stop giving her supplements. Okay, this is crazy.
Right, absolutely. So they just want her to reduce the supplements.
Well, they don't know why.
So, okay.
Maybe she needs triple the supplements, you know, who knows? I mean, oh, well, you know, we're not into supplements, so let's just reduce your supplements. No.
I think it's more out of convenience for them, Dr. Wallach.
Yeah, we don't want to have to sit there and count out pills for her every day.
Right. All right, Nasima has another question.
Yep. Hi, I'm on, Doc. It's a question from a client. Hi. In general, again, what are the effects of excessive alcohol, the alcohol choice being wine or a gluten-free alcohol, when a person is on medications, taking supplements, and diagnosed with cancer?
Well, it depends on what they want to accomplish. If they're a stage 4 cancer and the doctors have only given them a couple of months to live, I'd let them drink all the wine they wanted. Okay. If they're just diagnosed with cancer and they're at the beginnings of their treatments and everything, you know, they need to restrict alcohol to maybe 1 glass of wine a day kind of thing. Instead of a glass of wine with each meal. You know, you got to be reasonable here if you want to have your body do what it needs to do. And of course, take the supplements and so on. So these are common sense answers to questions. And there's many reasons why people ask those questions. Maybe they don't want to go to the store and buy the wine and bring them the wine. Who knows? Okay. But a glass of red wine once a day, if somebody even has 25% of their liver, that's okay. But you have to take the 90 essential nutrients so the body can defend itself and function and maintain, repair itself. A bottle of wine 3 times a day is not good.
Right.
Anybody.
Right.
Okay.
Thank you, Doc. And, you know, if someone has the issue with alcohol taking in excessively, it's because of nutrition deficiency.
That's
correct?
right. Pica, yeah, P-I-C-A. They have cravings, and alcohol will subdue the cravings a little bit because it acts kind of like anesthetic. It actually causes everything to quiet down, go to sleep and everything. And so you're not feeling that, gosh, I just have to eat every 3 seconds. Okay, that's why people get addicted to alcohol, because it does help them relieve some symptoms they want to get rid of. And they say, oh, well, now I'm addicted to the alcohol. Okay, well, get on the nutrients and slowly try to reduce the amount of alcohol without causing negative withdrawal symptoms.
Thank you, Doc. Right back at you, Rebecca.
Thank you, Nasima. So Dr. Wallach, Jenna has a question about her husband. He is 69 years old, 5'7", 181 pounds, and he falls asleep all the time, especially after eating. But anytime that he's just sitting still, like in a chair, he falls asleep. What is causing this and what can be done?
Okay. This is actually caused by what's called reactive hypoglycemia. Okay, when you eat, your body releases a lot of insulin, knocks your blood sugar down, you get sleepy. It's very common in middle-aged seniors, okay? It's one of those things where this goes back to the beginning of time. This is nothing new, okay? And so when people have these issues, they need to take more supplements, more minerals, and they need to eat more protein and less carbohydrates, okay?
So then as far as supplements, Dr. Wallach?
Okay, well, in this case, I would give this guy 2 healthy brain and heart packs per month, full dose of everything twice a day. I'd get him on 2 bottles a month of the sweeties, so he can take 3 of those twice a day. Might even want to get 3 bottles for a while and give him 3 of the sweeties with each meal. Okay, that's going to help modulate and moderate the amount of insulin being reduced. You know, again, this goes back to the beginning of time. This is nothing new, but it is a deficiency that causes the body to keep releasing more and more insulin, which drops the blood sugar, which causes them to go to sleep.
All right, thank you so much. So now, Dr. Wallach, let's get back to people that are going out and exercising. We got somebody that they said they're 47 years old, 123 pounds at 5'6", and she used to be an avid runner. She says now when she goes out and runs, she gets extreme pain in her calves and her thighs and the muscles. She said sometimes it feels like it's in the bones themselves, but not so much in the joints.
It's a back problem.
A back problem.
Yeah, she's got peripheral neuropathy. Okay, she's got sciatica. Okay, and so has this guy shrunk a little bit? You know, ½ inch or so that the vertebrae are getting closer, got to smash in those sciatic nerves. It's just like when somebody has numbness and tingling in their feet and toes and hammer toes and everything. They'll go to a foot doctor and they'll do surgery and all that kind of stuff. But it's really a back problem causing sciatica, peripheral neuropathies in the feet. Same thing when your skull is squeezing your spinal cord coming out of the back of your skull, causing what doctors will call, oh, you have carpal tunnel syndrome because your hands are going to sleep and you have trigger finger. No, it's a neck problem because the skull is squeezing, the spinal cord is coming out of the back of the skull. Okay, these are called peripheral neuropathies. Okay.
All right, thank you so much, Dr. Wallach. And we have, Dominic has a question about weight. And they're on 1,500 calorie diet. They did lose 12 pounds in the first month, and the next pound gained it back. And currently they're doing 20 flights of stairs with no significant loss, and, you know, trying to cut out the sugary foods, but haven't been able to.
Well, here's what they need to do. Start out with one meal a day or keto caramel bar. The shakes are gone, so just use a bar. One meal a day. Doesn't have to be the same meal every day.
We have strawberry chocolate though, Doc.
Well, we have strawberry chocolate, but it's not a keto shake.
It is. We now have a keto shake. So.
Okay.
Go ahead.
One meal a day. And after a month or two, go to maybe 2 meals a day, a keto meal, and see, you can lose a half a pound to 2 pounds a day, but they got to take the 90 essential nutrients, because the behavior of pica, cravings and eating and eating and eating and eating. You just ate a 5,000 calorie meal, Ralph. Why are you still eating? I don't know. I'm just still hungry. Well, that's because, you know, grandma used to say, you got a hole in your leg. You know, you just keep eating and eating and eating. You got a hole in your leg. That's why you're gaining all this weight, because you keep eating, 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 because you got a hole in your leg. The food just goes in and keeps piling up in your leg. No, that's because you're minerally deficient and you have this craving called pica, P-I-C-A. And again, this is where these books and the CDs and things come in. Really, people have to go in this direction, educate themselves, and not depend totally on a doctor 100%. Now, if you get run over by a car and you're bleeding internally, you got to go to the emergency room. No, you know, there's certain common sense things here. But if you've been fiddling around with a doctor and losing and gaining, or your blood sugar is up and down, your blood pressure is up and down, well, let's try this drug, let's try that drug. When a doctor says stuff like this, he doesn't know what he's doing. It's time for you to kind of take over and begin to do stuff yourself here. And with very factual information. We have the references, so you can look it up if you want to go to the original research, if you want to do that. But, you know, we've been doing this a long time, for 73 years. And so we have a little handle on this.
Just a little bit. So, you know, a lot of people think that you have to eat lots of vegetables in order to lose weight. And like Dominic is suffering with hypothyroidism, which the cruciferous vegetables you don't want in your diet. So it's mineral deficiencies, isn't it, Dr. Wallach?
Yes. Yeah, it's mineral deficiencies. And of course, you get these side effects, and then you take something like marijuana, or you take opioids, or you take a drug that makes you feel better. Oh my God, I love my doctor. I'm gonna leave everything in my will to my doctor. Okay, well, they're managing your symptoms. They're not getting rid of the disease. Well, yeah, I've been on these drugs for 12 years. Okay, try going without those drugs. Oh, I can't go without those drugs. I tried, and just, you know, within 3 weeks, all my symptoms came back. Well, that means the doctor is just managing your symptoms and milking you like a dairy cow.
Yeah, duct tape doesn't fix everything, does it?
Nope.
Let's go to the underlying cause, folks. Well, again, I just want to thank everybody for joining us with the Ask Doc Live program here, where we have the one and only Dr. Joel Wallach, who not only has been treating humans for the last 50 years, but started out treating animals. Animals can't tell you what's going on, folks. And through all of his research, through all of the autopsies and comparing millions of data points, he has figured it out. And because of the goodness of his heart, he's here to share that information with us. And it's been published many, many times over and over. So it's not just words, it's actual information, research, proven time and time again. So again, if somebody invited you to this program, get back with them. Tell them, hey, Dr. Wallach was mentioning this about this person. I have those same symptoms as well. I need to find out what protocol is best for me. You can then go to AskDocLive.com. You can pull up the recording of the program and listen to exactly what Dr. Wallach has shared. All of the products that are shared there can be found at the AskDocLive.com store, including Dr. Wallach's books that are just so valuable. Dr. Wallach, thank you so much for bringing all of this information to us. We greatly appreciate you and the time that you're taking.
Well, thank you, Rebecca. Thank you, Ruth Ellen. Thank you, Nasima. Thank you, John T. Thank you, team. And we'll see you next week.
Yes, on behalf of the whole entire team, everybody, see you next Friday, same place, same time. Have a great one and bye for now.
Stay away from gluten.
Yes, stay away from gluten.
Bye-bye.
Bye, Dr. Wallach.